Hi, my name is Alyssa Robb, and I'm a registered audiologist and hearing instrument practitioner under the College of Speech and Hearing Health Professionals of British Columbia. I'm also certified in audiology by Speech Language and Audiology Canada. This video will explain the necessary information that you require in order to understand the various tests performed during a hearing assessment. There are certain pieces of information that are required for a hearing test to be considered valid. The date of testing is necessary to reveal how recent the testing was done. The name and date of birth of the individual being tested is also required, in addition to the examiner's name and professional designation. The equipment make and model or audiometer used during the testing is also required. It's also important for the examiner to indicate which transducer was used during the testing. Was it an insert earphone, a headphone, or a speaker in the sound-treated booth? And the reliability of the assessment will be indicated. It's preferable to have a good reliability, but the reliability can also be marked fair or poor. The reliability refers to the entire assessment and not just the testing that was done. It includes the case history and questionnaire prior to testing. Otoscopy refers to what the examiner visualizes when they look into the student's ear canal to examine the eardrum. Common descriptions can be clear. This means that the examiner does not view any wax or anything abnormal when looking at the eardrum. It looks healthy. Clear can also be referred to as unremarkable or NAD, no apparent disease. Some other common descriptors can include wax or cerumen. Occluding wax can interfere with testing results. This means that the wax is fully blocking off the ear canal and the examiner cannot view the eardrum. Non-occluding wax means that the examiner could potentially see parts of the eardrum and the ear canal, and it may or may not impact the testing results. Another common descriptor is a perforation. This means the examiner can see a hole in the eardrum. The term retracted refers to the fact that the eardrum has excessive negative pressure and it is concave looking. Vascularized refers to the fact that there could be veins on the eardrum or some redness. PE, or pressure equalization tube, can refer to the fact that there is a grommet surgically inserted into the eardrum by an otolaryngologist or ear, nose, and throat specialist in order to relieve middle ear pressure or drain fluid from the middle ear space. Scarring can be a common comment that refers to the fact that there could be previous history of middle ear infections reoccurring or a previous pressure equalization tube that is no longer in there. Surgical in nature can refer to an abnormal looking eardrum or ear canal. Wet refers to the fact that there's possibly an infection or some draining in the ear canal. And dry could mean that there's psoriasis or eczema or dry skin in the ear canal. The audiogram, or graph of hearing thresholds, which are the softest sounds that you can hear across frequencies, is arguably one of the most important parts of the hearing assessment. When plotted, it details your hearing thresholds, the degree or severity of hearing loss, and type of hearing loss in each ear. You'll see on this graph, the blue X's, that's the left ear. The red circles are the thresholds of the right ear. The higher the symbols are on the graph, the better the hearing. Along the x-axis, we measure frequency in hertz, from 125 hertz all the way up to 8,000 hertz. On the left side of the graph are low, deep bass tones, and on the right side of the graph, closer to 8,000 Hertz, are higher pitched treble tones. Along the x-axis, or along the y-axis, we measure volume or intensities in dBHL, or decibel hearing level. It starts from -10 and goes all the way to 120 dBHL. This is a very, very quiet sound, all the way down to very, very loud sounds. We like to categorize hearing loss in terms of degrees. From -10 to 25 dBHL is considered normal hearing for adults. You may see from 16 dBHL to 25 dBHL, some professionals may document this as a slight hearing loss, and this is used for the pediatric population, people under 18 years. From 26 to 40 dBHL is considered a mild hearing loss for adults. 41 to 55 is classified as a moderate hearing loss. 56 to 70 dBHL is a moderately severe hearing loss. 71 to 90 dBHL is known as a severe hearing loss, and 91 dBHL and onwards is classified as a profound hearing loss. There are some symbols or a legend that can be seen on the hearing test. As mentioned, the X is your left ear and the circle is your right ear. This is to symbolize results measured through air conduction, or an insert earphone or a headphone. If headphones or inserts cannot be used, the examiner may indicate a threshold with an S. This is used to signify that the thresholds were taken through sound field, the speaker in the sound treated booth. If the student is wearing a cochlear implant or hearing aid during the speaker testing, then A is used to show that the student was aided. Bone conduction thresholds refer to the fact that the testing was performed with an oscillating headband placed on the mastoid bone behind the outer ear or on the forehead. This allows the examiner to determine the type of hearing loss that someone has at that particular frequency. The unmasked bone conduction scores are the less than and greater than symbols. And the masked bone scores are the brackets. Now, masking refers to the fact that the examiner has introduced some white noise or distracting sounds into the non-test ear because it is believed to be helping the test ear. Masking is used to isolate the full potential of the test ear. As you can see, the masked values of the air conduction using the headphones or the inserts are triangle for the left ear and square for the right ear. Or sorry, triangle for the right ear, square for the left ear. If the examiner attempts a test and for some reason cannot complete that test, the examiner will write CNT, could not test. If the examiner did not attempt a test, they may write DNT, which refers to the fact that they did not attempt that particular test. If a student has a stable, unchanged hearing loss for several years, the examiner may decide to skip the bone conduction measurements and document that on the testing. There are 3 types of hearing loss. A conductive hearing loss occurs when there is a problem with the way sound is conducted into the inner ear, through the outer and the middle ear. Some causes of conductive hearing loss can include wax or fluid in the ear, and as a result, the conductive hearing loss can sometimes be temporary and sometimes permanent. Sensory neural hearing loss occurs when there is a problem with the sensory receptors of the hearing system, specifically the cochlea in the inner ear or auditory nerve. Most sensory neural hearing losses are permanent, and there can be a number of causes. Mixed refers to a combination of both conductive and sensory neural hearing loss. In addition to the type of hearing loss, other descriptors could be used when describing a hearing loss. The term bilateral refers to the fact that there are two ears involved in that hearing loss. Unilateral refers to one ear. The term congenital refers to the fact that the hearing loss has been present since birth. The configuration or shape of hearing loss will also be described. Some descriptors of the configuration of hearing losses can include flat, sloping, steeply sloping, rising, cookie bite, U-shaped, precipitous, or notched. Another series of tests that can be found during a hearing assessment includes speech audiometry. These can be conducted using the examiner's own voice, which is live, or through recorded material. The recorded material is preferable because it removes the examiner variables, such as a very high-pitched voice, variable speaking levels, or accents. The SRT, or speech reception threshold, refers to the softest level of speech understanding that the student heard 50% of the time. If you compare the SRT to the pure tone average, or PTA, of each ear, the pure tone average is taking the average of the threshold at 500, 1000, and 2000 hertz. If the PTA and the SRT should be fairly close, and we also use this to assess the reliability of the assessment. The WRS, or word recognition score, refers to the percentage of correct words out of a list of 25 or 50 words. For example, say the word such, and in order for the student to score correctly, they would have to repeat such correctly. The higher the score, the better the WRS. So a score from 90 to 100 is considered excellent. 80 to 90% is considered good. 70 to 80% is considered fair, and anything under 70% we consider to be a poor word recognition score. Many audiologists will extend this to the individual's ability to hear speech clearly. The MCL, or most comfortable loudness, is the level in which the student has indicated that they feel comfortable receiving instructions at, or the examiner's voice. The UCL is the uncomfortable loudness level. This is where the student has indicated they would not like instructions or general speech to exceed. The QuickSIN, or Quick Speech and Noise Test, can be used to assess the student's performance when competing speech is involved. So you'll have the speech level and then the chatter in the background, and see how well they can repeat sentences or words back with the presence of background noise. If the examiner has introduced masking noise during speech testing, the masking noise level will be indicated on the audiogram. Most speech tests are done on each ear. However, sometimes the examiner may choose to do speech testing binaurally or through both ears. Immittance audiometry refers to a series of tests that are performed in order to assess the health and function of the eardrum, middle ear space, and beyond. One of these tests is called tympanometry. The tympanometry tells us the health and function of the eardrum. The acoustic reflexes are testing the 3 small bones in the middle ear space and beyond. Not all hearing health professionals will do these, the admittance audiometry during a hearing assessment. And finally, there will be a summary of the results indicated on the hearing test. And some common comments can include that the examiner would like to continue to monitor the student's hearing over time. They may also ask for a retest at a later date once wax is removed. The examiner may recommend a follow-up or a referral with a medical professional to see if there is something that needs to be medically addressed with the hearing loss and the ear. Further testing could be required. At some clinics, they don't have all of the equipment, or further equipment is required from a public health unit. The examiner could recommend a trial with amplification. This could refer to hearing aids, cochlear implants, or assistive listening devices, such as an FM system or an ear-level amplifier, and or application for funding or looking into applying for different programs. Many people or students who have a hearing test want like a take-home message, like how much percentage of hearing loss do I have? Hearing healthcare professionals hesitate to provide people with a percentage of hearing loss because at certain frequencies, the individual may have normal hearing, and at other frequencies, the individual may have a significant hearing loss. So as a result, hearing healthcare professionals choose to describe the hearing loss in terms of a degree. It's also important to note that each person's experience with hearing loss is highly unique. Two people with the exact same hearing thresholds may function completely differently. That's why it's important to ask the deaf or hard of hearing student what challenges they experience in the academic setting and what they have found to be helpful in the past. Also, share the supports that are available to them because they may not be aware of all of these supports or had access to them in the past. Thanks for listening, and as always, if you have any questions, contact ACE BC.